Chair, and I'm sharing this time with Deputy Butler.
Thank you.
Minister, I have 4 questions. I think I'll just give you the 4 questions and let's see what we can get done in 5 minutes. First of all, I'd like your thoughts on the fatality rate. So we're all agreed that extraordinary efforts are going on from the state, from the HSE, from every individual and family around the country. Unfortunately, when you look at the fatality rate for COVID-19 in Ireland, it's at about 90 people per million population. And when you look at that compared to other countries in the OECD, we rank 10th. Now, the data is not perfect by any stretch. However, Germany has about half the fatality rate we do. Norway has about a third. Finland has about an eighth of the fatality rate we do. So I know the data is not perfect, but it's probably directionally correct that some comparable countries, in spite of our very best efforts, have significantly fewer people dying per million population. My first question, Minister, is the government and department looking at this? Are we looking at what other countries are doing, countries that have a much lower fatality rate, to see is there anything more we can be doing? Are there things they're doing that we're not doing so we can learn and we can get this fatality rate as low as possible? My second question is a very brief one. It's on the current assessment of the reproduction rate. Can you tell us what that is now? And Minister, if you have the information available, could you also tell us where it's happening? So, for example, if the number is about 1, is half of it happening in homes? Is half of it happening in nursing homes? How much of it is happening through social distancing? Can you give us a sense for where the transmission is happening? And the third question, Minister, is on nursing homes. It is clear that the nursing homes are in the middle of their own crisis within a broader crisis. Very important supports have been promised to them. 2 weeks ago, the HSE told the health spokespeople that staff would be deployed, including clinical staff. There was a big announcement on the 4th of April from yourself for financial supports. There were big promises made around PPE, and there were also commitments to make sure that testing happened much quicker for residents and staff, and that contact tracing would back that up. To date, Minister, in spite of what I'm sure are everybody's very best efforts, a lot of these supports haven't materialised. PPE is patchy. One manager described it to me today as a lucky dip, that you don't get what you ordered. The Financial Supports Minister not only has a single euro not arrived at any of the nursing homes, but they're telling me that they haven't had a single communication from any arm of the state to tell them when they might happen, what the guidelines for those might be. In terms of staff, my understanding is in cases of extreme emergency where nursing homes literally have nobody left for a night shift or a day shift, the CHOs are managing to deploy some staff, but that actually this promise of a lot of staff being made available hasn't happened. Nursing homes are finding themselves without staff. RTE reported yesterday that nursing homes now are facing entire shifts with no staff. I'm also hearing from the Nursing Homes Minister that it's taking up to 2 weeks for the testing results, and that over the last 2 or 3 weeks, the nursing homes I've spoken to have said there has been no contact tracing. So we all want this to happen. We all want it to happen urgently. Can I ask, Minister, why has it not happened so far, and when are the nursing homes going to see a real difference on the ground where they need it? Finally, Minister, I'd like to just raise the issue of the non-COVID-19 fatality rate. There is new analysis out showing that the non-COVID-19 fatalities in Ireland in March and April are up an awful lot on previous years. And there's many reasons why this may be happening. I have a concern that we have empty private hospitals at the moment, empty operating theatres. It's what the doctors are saying to me. A lot of surgeons who want to treat people but essentially are having to sit on their hands. Their teams are having to sit on their hands. A lot of the HSE hospitals are below par. Can anything be done to start reactivating the health system? Thank you.
Of mortality rate. I suppose the first point I'd make is often in a pandemic you can see your mortality rate, the flattening of that lag some of the other indicators. So we're now seeing in Ireland our ICU admissions beginning to go in the right way, our hospital admissions beginning to go in the right way, our rate of growth beginning to go in the way, our mortality rate absolutely not beginning to go in the right way. And that is and should be a cause of concern. I think it's fair to say assessing comparisons of mortality statistics, as you've acknowledged, is not a perfect science and would require considerable analysis of your population structures, your demographics, your socio-economic factors, your health service capacity, transmission patterns, pandemic preparedness, etc. I think it's also fair to say that the reporting of mortality figures differs greatly amongst countries, including our nearest neighbour in the UK, where they only report deaths occurring in acute hospitals. Other countries, including Ireland, report all known deaths relating to COVID, regardless of the setting. I think it's also acknowledged that despite the fact that we have testing challenges in this country, of that there is no doubt, we are still ranking third highest out of 22 EU and UK countries in terms of the tests completed as a percentage of the overall population. That's according to our World in Data website. So this is also likely to have an impact on our mortality figures. We're actively looking for the virus, trying to find the virus, and therefore confirming more people have died of the virus. You kind of are cutting across me.
To get in and follow up privately with the Minister afterwards. I just don't want
I'm
all
not sure I'm
Deputy
happy
Butler's
on the
time
record of the House
taken.
to have very important issues raised that I don't respond to, but I'll be very brief. But I mean, we can't raise very important issues for questions and not seek the answers for the public watching this. I think that's the purpose of this session. In relation to the current OR number, I think it's a really important question that Deputy Donnelly asks, and I don't want to take Deputy Butler's time. Philip Nolan will give an update this evening, but I'd like to share with the House that we now have 4 different methods to estimate OR, and they're suggesting that the OR is now between 0.7 and 1. So some encouraging news that it looks like the OR is now at 1 or below. We were saying it was in and around 1. So Professor Nolan will present the graphs to back that up this evening. It looks like we're beginning to see that as a plateau in the hospitalisation cases and the critical care cases, but not yet by any manner or means a decline in new cases. He'll also show this evening, and I think this is important information, that if our epidemic had continued at an OR of 2.4, we would have seen 7,800 new cases today and 800 people in ICU today and at least 1,700 deaths by this day next week. In relation